We're going to be calling the July 10th, 2024 Monterey County Emergency Medical Care Committee meeting to order. And with that, we will start with a roll call.
Roll call. I mean, I think I'm.
An introduction.
There, that should be better. Okay, roll call. Will Hiller. Here. Sam Clemick.
Here.
Jim Langborg.
Here.
Harry Robbins.
Here.
Jody Schaefer. Paul Wood.
Here.
Spencer Harnett. That was here earlier. Carla Spencer.
Here.
John Anthony. And Chris Borquin. Alternates, let's see. Dr. Hoff. Need. Tomorrow, because we got Carla, Sparkin, Andy Smith. Andy Smith? Nope, but we do have a quorum. So, any alternates would like to announce their presence?
Michael Leo, CAL FIRE EMS.
Joe Cafaro, Hospital Council.
All right, thank you. Ex officio members? That would be Teresa Rios.
Yeah, I was trying to unmute myself.
Yeah,
I'm here.
and then Kelsey Scanlon and Leah Magoski. Okay. We do have a quorum. We can do guests.
Guess like to do a brief introduction.
Sure, I'll start. David Sargenti, Monterey County Regional Fire Chief.
Morning, Steve McChristy, Salinas Fire.
Shane Vanderveen, Salinas Fire.
Leslie Oliver, Emergency Communications.
Jessica Amor, Comms Manager.
Good morning, Christy Sobeski, Johnson Emergency Department.
Good morning, Jalen Neal, Emergency Medical Services.
Good morning, Deborah Hopgood with the EMS Agency. Blake Anderson with the EMS Agency.
Morning, Jeff Waterwood, CalStar Air Ambulance.
Marie Lutz, physician at NetSpeded.
I missed you, pardon me. Dr. Lutz is a new member. She was appointed by the board yesterday. So I was using minutes from the last one to catch you. So yes, new member and present. Thank you.
Sam Clemick, Salinas Fire.
Yeah, do we got you?
Through.
Karina Moreno, EMS Agency. Kimberly Hernandez, EMS Agency.
Steve Brooks, CMS Agency.
John Burley, EMS Agency.
Okay.
Online, if anyone wants to announce.
Anyone online want to introduce yourself?
Captain Haggy, Fort Lake Fire.
Good morning, Nick Becker, General Manager, Pebble Beach Community Services District.
Okay, we'll take that as the end. We're going to go ahead and we're going to jump out of order just slightly, and we're going to move item 6A to the top, and it has to do with EMCC committee reappointments, and we'll turn that over to Steve.
All right, well, before we get to that one, if we could maybe move to 7B, because that would be the nomination of the chair.
I thought that was, okay,
Oh, yeah.
my apologies. I guess it's 7B, and nomination and election of the chair and vice chair.
So according to the bylaws for the EMCC, at the July meeting, we have a transition for the chair and vice chair. We unfortunately at the previous meeting, the May meeting, we did not have this as an agendized item. So we were unable to accomplish this at the May meeting, but now that it's on the agenda for this meeting, we are taking nominations for chair and vice chair for the 2024-25 session of EMCC. With that,
Chair, I have a motion.
Okay.
I'd like to move that John Anthony be our next chair and Will Hiller be our next vice chair.
Second,
Second.
Do you want to do any other nominations? Yeah.
any other nominations? Okay,
Now we can do a
vote.
vote.
Just point of order, are those nominations accepted?
And, well, John's not here, so
Yeah.
he should have been.
John's not, you spoke to John and he accepted?
He is currently our vice chair.
Yeah.
And then the progression usually is the vice chair usually moves up unless there's some compelling reason not to. Considering all of us have demands on our schedule, I anticipated that someone may not be here, but I think that there's a precedence for that.
Well, good question. We can nominate and you can elect, and he can certainly decline, which I will be reaching out to him after the meeting if you do so elect. And then at the next meeting, we can.
I have previously asked John if he would serve as vice chair and with the intention to probably move up.
Okay.
So clarify that.
Okay. So if he does feel like he's unable to
You can always decline.
participate, he can decline, and we'll bring this back as an agendized item for the next meeting.
Well, could we also just add on to it that if he declines, we just move Will up into the chair position?
That's an option.
And just save that, and then we only have to deal with the vice chair.
That could be the motion.
I can modify my motion to that effect.
Sounds good.
Any other discussion?
Will?
Yeah, I'd be honored to help out. I can't vote obviously on that one, but I'd have to abstain from that process.
I don't know if there'd be a conflict of interest. I mean, that somebody else can think of a reason, so you could certainly vote for yourself.
I'm sure, excuse yourself. That has happened in the past.
Okay, well, with that, let's call for a roll call vote. Motion being to nominate John Anthony as chair, and assuming he's willing, he will be elected with actually, do we get a second?
I second.
Yeah,
Second.
you had a
Okay,
second.
thanks. Wait a second here, I make sure I don't forget. Okay, so motion being John Anthony as chair, Will Hiller as vice chair, and if John Anthony is unable or unwilling to accept the nomination, that Will Hiller would become the chair, and we would bring back for a nomination of vice chair at the next meeting. That's nomination, so let's do roll call. Will Hiller.
Abstain.
Okay. Sam Clemick,
Aye.
Jim Langborg,
Aye.
Harry Robbins,
Aye.
Jody Schaefer's not here, Paul Wood.
Aye.
Dr. Lutz.
Aye.
Spencer's not here, Carla.
Aye.
John Anthony's not here. That is our membership. Motion carries. And that's effective this meeting.
Oh.
So, Mr. Vice Chair.
Real estate here.
Okay.
Chief.
You got this, Will.
Congratulations, sir.
Thank you so much. Right.
So with that, since you haven't had a lot of prep, definitely be here to assist with this. So with that, we're then moving back to the regular agenda and approval of the EMCC meeting minutes.
So, ask for a motion to
Ask for
approve.
motion to approve.
So moved.
Second.
Do a roll call for that one too.
Yep, as soon as I can get the names.
Sorry.
That's okay. Okay, so motion to approve the meeting minutes from the May 2024 EMCC meeting. And roll call, we have Will Hiller.
Aye.
Sam Clemic.
Aye.
Jim Langborg.
Aye.
Harry Robbins.
Aye.
Paul Wood.
Aye.
Dr. Lutz.
Aye.
Spencer Harns, I hear. Carla Spencer.
Aye.
And no. Okay, motion passes.
So moving on to reports then, so item A, medical director.
Okay, thank you. So the clinical care committee just met a few, about an hour or two earlier this morning, and we got an EMS agency update from Teresa Rios. We also had heard from Kimberly regarding ambulance patient offload times. And just to update this committee, there was some discrepancy between the data between the county and the state due to some reports not being received by the state, so they didn't have up-to-date data. So the EMS agency has met with the state and will continue to work with the state to make sure that they're receiving all the data that they need to, so that our data can be in sync. We spoke some about the health data exchange implementation. Steve was kind enough to give us some updates on the 2024 policy protocol review cycle and the upcoming 2025 review cycles. And then we also heard from Blake regarding CQI tag. Just a few highlights from that was that he did a deep dive on CPR and patient outcome, and what he found from his recent investigations was that we've had a bit of a dip in our successful resuscitations, and in breaking the data down a bit more. One factor that may be involved is we've had decreased bystander CPR in the most recent year compared with prior years, which may provide an incentive for us to take a further look at that and try to increase bystander CPR through outreach and other mechanisms. We also in CQI tag had reminded agencies within the county that the state is asking for agencies to complete the pediatric readiness survey, and we've had pretty good response to that. If you haven't completed that, we would appreciate you getting that done so that we can have everyone involved. And then we also had mentioned that several agencies had still not completed their annual QI plan, and that the EMS agency has reached out to those agencies to make sure that we get your annual QI plan. Those were the highlights of our CCC meeting, and I'm happy to entertain any questions or comments. Thank you.
Dr. Burke. All right, moving on to item B. EMS director.
Thank you. There is no report from the apps working group as it has not met. And we'll be having a discussion internally about agenda items and things that could be appropriate for the apps working group.
Thank you, Teresa. And again, to item C.
I'll take the next one. Thank you very much. Just a few things. We are very active with other projects. Some of them are their own agenda items on today's agenda. I do want to highlight that the EMS agency has been working with the health IT department to develop a database to help us better track the unusual occurrence reports. So we reported on this before. We are trying to realize some efficiencies internally so we can better manage the programs that we have. And that project has been spearheaded by Kimberly with the help of the rest of the team and of course the IT team. And we're in the testing phase of the project. I wanted to make sure to update you today because at some point in the very near future, you will be contacted related to the rollout of the new database and how that's going to affect how you submit the UOs. Our goal for this database is not only to make it easier for more user-friendly, the process of submitting a UO, but just the internal tracking of taking that UO from start to completion and in the assignments and all of that to be an easier, a smoother process. We are trying to cut down on the time that it takes us to process UOs. In the recent time, we did get behind on the UO reviews, and I think that the management of them is part of where we run into some problems, but also there are times that we are requesting information from the agencies involved in a UO, and sometimes we experience delays getting the information that we have. So some of that follow-up, we're trying to find ways so that the system can trigger the reminders for us to take on the items that need action. So more to come on that. We are excited that this is coming to fruition. On our list is also the database for for tracking the EMT and paramedic applications. We hit a snag with that because as those of you who submit applications know, we don't have the capability of accepting payments electronically. And for us to do that, we need to be connected to not the assessor's office, the tax collector's office. So they had a project that they were working on that they could not put us in the queue. And then we also needed to work with the vendor to make sure that their system to talk to the county system. And it's been a lot of hoops that we've needed to jump through, but the goal is to complete that project this year so that we can also do a better job at managing that and make it easier for the applicants. The database, the vendor we selected, that database is able to automatically send notifications for us, reminders of whose EMT or paramedic certification licensure is up for renewal, so that notifications can go out. And when the packages come in, the goal is that we get pretty much a complete package. So the system will track all of the items that are needed for the application. And first, the applicant should not be able to submit an application without all of the items being attached. And then the second phase would be the EMS analyst going through all of the items to make sure that they meet the requirements, which is not something that can be automated. But the communication between the EMS agency and the applicants will be more real time. And we do a pretty good job when processing the EMT and paramedic applications in a timely manner based on the time that is allowed to us according to regulation. We do get every now and then a straggler that takes us a little longer, but for the most part, we're not 100%, but we're very close to 100% in processing the applications in a timely manner. I also wanted to let you know that our recruitment for a health program coordinator is underway, and for the EMS analyst, we have released the recruitment for both positions. And we should be pretty close for the health program coordinator. That recruitment went out a little bit earlier, so we should be moving to interviews in the near future. So hopefully we'll be able to add at least one more person to our team who can help us pick up the slack. And there's so much work to do that we really need the additional people to help us with that. Lastly, I want to mention, it's been brought up in different committees and even in this one, some of the issues that we've had with the data in ESO. The team does hold regular meetings with ESO, but we are at the point where we feel that some of the issues are taking long. I think that the work that they've done with us for HDE has been good in the last, maybe seven to 8 months. Some of the delays have been in part on the hospitals and for a variety of reasons, but the progress that we've seen, the work that we've done with ESO has been good. But on some of the other issues, is not as the progress is slow. and the issues with the data itself and the challenges that we've had sometimes pulling reports, it's become very frustrating. So we're at the point that we are going to escalate the issue and see, get either more help or something, but something needs to change. So more to come on that once we get to that. That's the extent of my report. Oh, there's one item, and Deborah, if I could ask you, maybe you can speak to this item on the survey that the children's survey that came in. They were asking the agencies to complete. Is that an item that you could cover?
I'll let Blake cover it if that's okay.
Yeah.
Oh,
So,
please, thank you.
Yeah, so as many of you have received emails from me, the state reached out to basically every LEMSA with asking them to reach out to their providers to complete this pediatric readiness survey. And this is actually a national survey, so this is not just the state of California, this is everywhere. And the purpose of the survey is to gauge pediatric readiness and particularly the pre-hospital care. The goal is to get every agency to complete this. We set an internal deadline within the county, I believe was June 25th. I'm just making sure, yes, it was June 25th. And we continue to touch base with everybody who has not completed it. We get a list from the state, and I'm also able to go onto the website and see who has not completed it. There have been some issues, whereas in particular, I'll mention CAL FIRE. They cover several jurisdictions, and so they were listed 3 times, so they had to complete it 3 times. So we've worked with the state to make sure it accurately reflects what our county looks like and all the agencies that are there. I will report that while we do have quite a few agencies that have not completed it, our completion rate is twice the state average as of right now. So we are actually doing a fairly good job. But the state is also constantly checking in. I received a phone call yesterday, and they want us to, again, promote this. There's grant funding that will come with this. And so the more agencies that complete this, the better idea, the powers that be know how to, what kind of guidance they need to give and what action needs to be taken in the realm of pediatric pre-hospital care. Go ahead.
2 questions. One, clarification. That's all, when you say agencies, it's all first responders, right?
It is anyone who responds to 911 for fire and EMS, in that sense, yes.
Does not include law.
Does not include law.
Okay, fire and EMS. Second one, will there be any feedback on that data to EMSA or this panel?
To EMSA, I believe there's supposed to be feedback. However, I've not been given any of that information. I do have a point of contact who I can reach out to the state, and I can get an answer to that question for you and report that back.
I think it would be informative for us to know where we might stand in that regard, or what our preparedness is.
Yeah.
As a county.
And I think one of the concerns that was brought up is the detail in which this assessment goes. It's a 200 question assessment.
Oh, wow.
And it was initially advertised as it should take 30 to 45 minutes to complete, which in getting some feedback from our providers, doesn't sound like it's that easy of an assessment. I think one of the questions that was asked is, has your medical director had a fellowship in pediatric? Most providers will not know that information, and it goes into policy. So from what it sounds like, this is kind of the first time this assessment as it is has been made. And in talking with the state, they're looking to give feedback to the agency that is providing this assessment and relay that and going, this might be a little more than what most providers are aware. So when we ask you to complete it, we're asking you in the sense of do it to the best of your ability. We realize that some of these questions might not be really, something that you know off the top of your head. So just complete it to the best that you can. And please, I reach out to every agency that has not completed it yet. And I give them a deadline by the end of the week. So any other questions on the assessment? None? Thank you very much.
Right. Okay, so moving on to item D, Deborah.
Yeah, so we've been pretty busy with a variety of different training and actual response activities over the past couple months. In June, we participated in a surge exercise that we helped coordinate along with the hospital preparedness program and it involved a simulated surge of patients to all 4 of the hospitals in the county. We worked on things like ReadyNet notifications and patient tracking, Mohawk requests, that sort of thing. We're also working on an update to the hospital preparedness program. It has a section for LEMSA activities. So we'll be updating that, bringing that in line with our activities that we're doing. We also participated in the AAR for the recent active attacker tabletop exercise that was sponsored by the Bay Area UASI. And we'll be working to participate in the next year's, I guess, full-scale exercise that will come out of that. We did some planning and preparations for the heat event and the potential public safety power shutoff. We compiled data on residents with who are electricity dependent in those potentially impacted areas, work to assess what the impact might be, and then to monitor data on EMS system demand during that time period. We didn't see a significant increase in demand during that weather period that we've looked at so far. And then finally, we are starting preparations for Car Week. DEM has asked us to put together a medical plan, much like we've done in the past couple of years. So we've reached out to the agencies who typically provide some staffing for that. We'll be compiling all of that information into a plan and providing that to DEM and then participating in planning meetings. And that's all I have, unless anybody has any questions.
Thank you, Deborah. All right. Moving on to section 5, EMS performance metrics, communication system testing.
Okay. So 800 megahertz and ReadyNet drill and testing reports are included in your agenda packet. I'll just go over a few highlights. So and we're looking at April and May. So you'll see for May, 800 megahertz at Natividad was low. That was due to them not realizing that their 800 megahertz radio phone was unplugged. So they took that out and plugged it back in. And I want to shout out to Chomp and to AMR Dispatch for having some 100% response, and also drill and test conduction for dispatch. They were able to do all of the testing in May, and for April, Chomp responded 100% for 800 megahertz. And unless anyone has any questions, I'll move on to contract compliance. Okay. So for ambulance contract compliance for this, again, this is for April and May. You'll see for overall priorities, priority 6 in April was at 77%. I want to remind everyone that there is no 100 call rule that applies for the overall monthly percentage. And just to kind of point out how small the call volume is for April, priority 6 was at 9 calls and 2 were late. So that's what they were at, 77%. Other than that, all the reportable priorities within each zone that they all exceeded 90% compliance for April and May, which is amazing and great. MPDS overall call percentage was 81% in April and 76% for May. And it's also in your agenda packet. Does anyone have any questions on contract compliance?
Kimberly, could you just touch just briefly on what we look at with respect to South County and North County, and what our periodicity is that we go back and look closely for underserved areas in South County cities and North County?
So with the contract compliance, Harry's referring to the contract compliance working group. So we've been looking at South County responses we're doing it on a biannual basis, because some of the jurisdictions, the call volume, it doesn't make sense to do it like on a monthly basis. So we've been looking at that. And then we also did a review on North County, which was for an annual, because the call volume in some of those jurisdictions or their communities is very low. So we've been looking at that with the contract compliance working group. Any questions? All right.
Moving on to item C, fire-based ambulance report.
And,
That is in September.
September, sorry.
Yeah, that's okay.
All right, old business, item A, EMCC reappointments.
All right, so as we've been discussing at previous meetings, we still need some recommendations from responsible bodies for people who, represent, such as like city managers. So you'll be hearing from me when the meeting's done. I'll go shoot some more emails, and please get the recommendations from the bodies so we can take you guys to the Board of Supervisors for reappointment. And again, we got Dr. Lutz appointed yesterday by the Board of Supervisors. She completed her oath of office promptly, which is also, important step. And so she has joined as official member of EMCC. And that's reappointments and appointments.
Moving on to item B, Teresa ambulance RFP. You muted, Teresa.
Thank you. I am happy to report that the RFP has been submitted to the state after the draft RFP scope of work was released for public feedback, and all of that feedback that we received. We worked on revisions, which were reviewed by council and contract purchasing. And once we got to a good place where they approved what we had, we submitted to the state. The state has had it, and this is the part where we start also now back and forth with the state, answering questions, providing clarification. In some cases, they ask us to make further revisions to the RFP. So what the final version will look like, it will depend on what the state, what that feedback from the state is, and whatever changes they recommend that we make. Just to remind the group that we cannot release the RFP until we get the state's approval. The EMS agency also cannot receive antitrust immunity until the state agency approves the RFP in the process. So we are just waiting to see how long that final that exchange happens, and for us to get the final approval. As soon as we get the approval, we should be able to release the RFP for bid within a day or two. We've been in contact with contract purchasing. We've kept them up to date as to the status of where we are, especially this part where we're sort of sitting ducks, particularly contract purchasing, because they can't release it until we give it to them. We can't give it to them until the state approves it, and the state won't approve it until we have answered all their questions and we've made whatever revisions they feel are necessary to the RFP.
Any idea as to when the state is going to return it?
They never give us an ETA on an RFP. It all depends on how many they may have in the queue, and any other thing, like when COVID happened, it extended the time that the state would take for review because of the impact that it had on every agency. We are hoping it will not be a very long time. Just from other RFPs, they have been active recently, and also speaking to the consultant we secure for technical assistance. They deal a lot with RFPs, and they do a lot of dealings with the state. Is roughly about a 2-month turnaround on RFPs. Don't take longer. It all depends on how many questions the state will have.
Teresa, would you be able to provide any of those questions to this group at some point then, just to the sake of transparency?
At this point, yeah, at this point, the process is closed. How much interaction we have with stakeholders or members of the public is very controlled by council and the state. I would have to consult with council and the state and see if those questions or changes can be released. But it's not something that's come up before, Chief. So I would have to inquire about that.
Thank you.
Any other questions? All right, thank you, Teresa. On item C, EMS ordinance revisions.
And that's on hold.
It's on hold. And on to D, health data exchange.
Morning, everyone, and in your packet should be a health data exchange report. I'll just briefly mention one key takeaway that was written in the report is that pardon me if I can pull up my notes here, on May 21st, the Monterey County Board of Supervisors approved an ESO agreement between the EMS agency and ESO on electronic healthcare records services. In that agreement, the program EMPI, which we've discussed previously, but I'll give a quick synopsis. In the HDE program, where it looks to pair PCRs with hospital charts and patient outcomes to the PCRs, EMPI is an add-on which will help facilitate and improve the number of outcomes that are connected within the system. So that the EMPI system is in the process of being implemented, and we are working with ESO on that. But that was one of the big talking points of our HDE meeting. Outside of that, does anyone have any questions on what was written in the report?
If I may provide just a quick clarification that what went to the board is an amendment to both to extend the current contract with ESO and also to add the EMPI platform to the contract.
Thank you, Teresa. And Chief Surgeon?
Yes, I appreciate the update, Blake, and this has been one of my hot topics. I've been in front of this board 2 or 3 different times now. And first to Dr. Lutz, I appreciate NMC's commitment to doing this. I think this is the one time that government actually beat our private partners to the finish line, which I congratulate you. I do want to put emphasis on our private partners with Salinas Valley as well as CHOMP. We're still waiting to get these details worked out, and we're going on 2 years since this board has been involved with this process, another 10 before that. So I'm really hoping that our other partners with SVH and CHOMP can continue to move forward so we can get this critical piece for our firefighter paramedics and our ambulance paramedics so that they have this resource available for their QI process, which is lacking in this regard. So thank you. Welcome.
If I may, Blake, I wanted to say thank you, Chief Sargenti, for your words, because we know this has been a hot topic for you as it is for us. I think we do recognize that it has been a long time since the HDE project started some years ago. It predates most of us at the agency. But since we picked it up in last August, I think it was August, September when I got involved, there has been a great deal of progress. We do know that for SVH, there have been a couple of changes in leadership. I believe that Carla Spencer is now taking the lead of the project, and they needed to be, SVH did ask for us to just give her time for her to get up to speed on the project. So we're hoping that with Carla being part of the committee and having been so intimately involved in the discussions about HDE at this meeting, that her learning curve will not be so great, and so the delay will be minimized. CHOMP, of my understanding from, they're 3/4 of the way done. I think we're close to the finish line, so we are really hoping to be able to see that implementation very soon. And then Me Memorial, their project was on hold for a variety of reasons. We have helped to identify some solutions, and we're hoping that they will start the ball rolling very soon as well.
Thank you, Teresa. Anyone else have any questions or comments?
Did ESO provide any updates for the EMPI being system-wide?
No, I am set to talk to Lacey Thompson, the ESO representative for the HDE project this week, to get a further assessment on where that is. The last conversation we had with her is we're starting the process with some of the hospitals on making sure it's getting implemented. So our hope is by the next working group meeting that we can have some sort of report to give to the group on saying that EMPI is working within at least one of the hospitals. But I will continue to work with our stakeholders and provide further updates on that.
That's the question I have is can we make sure this is on the agenda for the next meeting? Because obviously this has dragged on for some time now. And so I'd like to see some progress.
Absolutely, yes.
And I'm sure the people in the field would like to see some progress too.
Yes, no.
To my understanding, I could speak for our organization. We were fully operational, but they did not, in the initial request, include the hospital inpatient physician notes. And so they came back to us to say, hey, can we add this? So we were operational prior to that. So I don't think it'll take us too long. Like that says, we just have gone on transition with Lisa retiring and me stepping into that role. So.
And I'll even actually add a little more to that. So it was the key element in which you guys were referring to is the physician's notes, which in some cases was hard to for some people to acknowledge because there was two physician notes elements, which were we had to provide some clarification. One is from an ED discharge summary, and one is from an in-hospital, whereas the patient gets admitted to the hospital, and which a lot of patients do. That was another element that needed to be shared. So Salinas Valley has agreed to, as of right now, the ED summary and their leadership team is to meet and collaborate and report back to us on the in-hospital discharge summary as well.
And then just a heads up, we are moving to Epic. We're just starting that journey. And so we'll have to do some rework in the future, but that's a year and a half process for us.
Anything else I can answer? Hearing none. Thank you very much.
Right. On to item E, EMS agency report to the board. Steve?
The EMS agency report, which was endorsed by this committee, went to the Board of Supervisors in May during EMS week, and the presentation was well received. The Board of Supervisors hopefully gained an appreciation for the work that's done in coordinating the EMS system. A couple of the board members pointed out their own personal experiences with our EMS system, and we're very, very complimentary of the people who provide the care from pre-hospital through hospital care. So well done to our system, and this did go to the board during EMS week in May.
No specific questions from the board relative to the report?
There were no questions related to the report from the board. But it's a good report, and we appreciate this committee's participation in endorsing it, moving it forward.
On to item F, EMCC.
The EMCC annual report, I again appreciate the work from this committee. It went to the board yesterday and they received the report, and hopefully it will give them an appreciation for the work done by this committee that they appoint to help with an overview of the EMS system. So it's been given to the board and accepted.
Questions?
Oh, I should say one more thing. Related to the EMS agency report, very nice article in the Herald related to the report and the EMS system. Copy was in your agenda packet if you're interested in reading it.
Yeah.
Thank you, Steve. So on to new business and item A, EMS policy 3030, section 3D for provision of EMD determinant code to first responder agencies at dispatch. Chief Cummings.
Thank you. At our last meeting, if you recall, I asked this to be put on our agenda.
just for, as a discussion item, for the last year or so, Salinas Fire Department's been engaged with the ECD, the 911 system to help us get information in front of our responders as they're responding to calls to help us make determinations about prioritizing our dispatch. This goes back to the ultimate goal of medical priority dispatching and really getting it to 100% of our calls. It initially kind of centered around our alpha and omega calls and things in EMS policies that we didn't necessarily need to respond to. But we really are looking at it as a global tool for us to look at all of our responses. While it initially looked at only being, less than 100 calls or so a year, it really affects 18,000 calls a year for the city of Salinas. And more importantly, how we prioritize our responses to really reduce our reliance on mutual aid, increase our unit hour availability, and just get our response times down where they need to be, where we're currently suffering in certain areas of the city where the ability for us to prioritize our dispatches and how we respond is really, really key to the success and providing service, not only to our citizens, but also being respectful of our neighbors, dragging them into the city to come run our calls while we're busy doing other things. So really, I wanted to provide a little bit of that perspective. The EMS reference 3030 section 3 talks about just providing these determinant codes, but it's really kind of thin to that end. It just says it will be provided, doesn't say necessarily how it will be provided. And that could be taken any number of ways, electronically, real time, strapped to a carrier pigeon, or put in an envelope and mailed. So what I'm looking for is just a little bit of discussion around at this group, and looking perhaps to EMS agency staff to also help us work through maybe some retooling of this section that would help us get determinant codes in a, I would say, consistent manner for first responders, mainly in our mobile data system. And that's what we're talking about is we realize that there's some challenges that have to do with the way we're dispatched currently with dispatch staffing levels at our center. And we are very mindful of that and we respect that, but also, again, to put perspective on it, it affects us as well from a response standpoint. And we think that what we look at when we look at these determinant codes, it's affecting really applying some of these NPDS algorithms and philosophy to all of our responses, fire and EMS, not just these very few calls a year. We have some specific examples that, I can share at maybe a future meeting or during a policy discussion. But I'm just simply asking this body to make an effort to take a look at the policy, especially since we're in an RFP. And should we get to a contract negotiation standpoint, and really understanding that this is really important for the city of Salinas. I'll put on my Fire Chiefs Association president hat, knowing that there are other agencies out there that this affects as well. And that we would just like some consideration in that discussion, perhaps tightening up this policy a little bit, just to make it a little more clear about this issue.
I have a question. So, and I apologize, so just for my own clarity, I mean, it sounds like it's something that is centered towards the provider. But it's my understanding that data already exists in the CAD that you should have access to, that would be, I think, on your terminals, right? I mean.
Yeah, for all our ambulances, it shows it on the CAD, every single question we ask. And at the end of the EMD, it shows the determinant on the call.
Leslie, before I speak, I'm actually going to qualify this a little bit further. We have been working with ECD with an update to our mobile software that would potentially allow our officers real time to click into the ambulance side of the CAD detail to get that information out. It looks like it is it is a viable option, but again, it's us moving to an updated platform that we're also considering countywide, moving away from. The fire chiefs are looking at another platform for mobile data, which is purported to potentially be able to do the same thing, maybe a little more streamlined, but we have not gotten to the testing phase of that to confirm it yet. So with all due respect to Leslie, we are working on a workaround, but simply putting these codes into the lines of CAD on our side of the fence, so we aren't leaving our side of the CAD, we're not flicking further into the detail. It really makes it clearer for us, for those officers to be empowered to make those decisions right away. Again, respective of the workload of CAD, we're not asking necessarily dispatchers to change our priority based on something they're reading. And we know the information lives there within CAD, and we know that on the EMS side of the CAD, it is being put there. We're just trying to get a slicker way of getting to it, and a more consistent, get us up above that 50-60% of the time where we might actually see that code and get it in there in a timely manner so we can make those adjustments during a response, not 2 or 3 minutes or 4 minutes into a response. So.
Chief, my question is, you alluded to other agencies, you focused on obviously on Salinas Fire right now, but is this applicable to all of the fire agencies? And do they have the capacity to deal with it, to get that information?
I would say in a general term, we have other fire ALS providers that have mobile data, capabilities that may or may not be looking to do exactly what we're doing. I'm proposing it as a system enhancement, as a system improvement, making a more efficient system. Whether they choose to use it the way we would use it, whether they're looking to change their response priorities. I'm not going to speak for any of the other fire chiefs, other than anecdotally in having those discussions. It's something that we all agree is valuable information to have. I don't know, Chief Sargenti, your 5 bugles over sitting there. If you want to comment, please feel free.
No, I echo your comments. I think it's one of those where the information's available, then it should be available to everybody.
Okay.
It seems like there's some limitations on the technical side, depending on what type of system we're in. And I know Chief Clement has been working with the providers to try and clean that up.
That's my point. Okay. Thank you.
And I think from my perspective, I'm just reluctant, shall I even, probably a poor choice of words, but maybe even resistant to a certain degree, want to be mindful of the people that are actually doing the EMD process. And I think that, we want to make sure that obviously you're getting that data. I think it already lives in the CAD, meaning that in real time. Could be wrong, I'm not the expert, but when they're, when they finally have made the determining, it's in the CAD, I think that you would see that kind of in a live feed. We're all in the same CAD together. So that would exist. What I would be fearful of doing is to create additional processes that when, there's only 2 dispatchers working at a given time, and they're, trying to manage the system status, the deployment of the ambulance, and also doing EMD with the patient, to add another task for them that they have to do, either a manual dispatch to the fire service or whatever. We can work together on navigating that, but I just, most recently this year, Will and I had an opportunity to spend a lot of time in dispatch and really became very much aware of how, especially when it's really busy, how much they're trying to manage at that time. And I think if there's ways that we can somehow get you access to the live screens that we see within the CAD that already exists, I think that would be, probably the most reasonable option to get you that info.
So to speak to that, the determinant code is only visible on the EMS side. So once the determinant code is set, it's only visible on the EMS calls. It does not move over to the law and fire side. And all of those calls are linked. So any data, any EMD data that is put into the EMS call can only be, if we were able to put it into all of the related calls, it would also go into the law call and the fire call. And so there is some concern about, during a critical incident, our dispatchers being able to sort through that information to not miss critical scene safety, officer safety, public safety information that might be missed when it's jumbled in with all that data. But we have worked with Salinas Fire, like Chief Clemick said, to get that determinant code visible to the Salinas Fire MDCs.
Yeah, because I think in some of the other systems, it's just a configuration issue. It's just a matter of, and I'm not the expert, but I'm sure there's a way of doing it. So it's, you know, prominent in your system that it's visible. And I don't know if you're looking for a work group or what, but we can definitely work together on figuring that piece out.
Well, and again, to Les's comment, it actually is not put in our side of the CAD.
Right,
as a
it's
standard.
not visible, yeah.
Can I ask, but it can be, right?
It can be, and it would be visible to all of
Right,
all of the
and
related
fire,
calls.
because it used to be, and then it
Yes.
was,
And then because when
off.
we implemented it was the CAD system in 2017,
Right.
it was visible to
Right.
all agencies. And that was why it was eventually turned off, because that data was a lot to
Right.
wade through at times.
right, and to speak to Mike's point is right now, the way that EMD with ProQA, how it talks to, ProQA is and you already know this, Leslie, and so is Jessica, but ProQA is the platform or system that the EMD is done electronically through. And so that information is automated, right? And also, Chief Clemick, I wanted to point out too, because you said having a real time, the response or knowing the determinant, it will always come in at least a couple minutes after, because they don't get a determinant code until the EMD is complete. So you'll never get an EMD code as soon as the call drops. So I just wanted to point that out, because the EMD process starts as soon as the call drops in their queue while their partner's dispatching the ambulance. They're doing the EMD, and then that's where the ambulance will get upgraded, even though it may be already going code 3, but now they can't be diverted to a priority 1, or they get downgraded a couple minutes into their call because now the EMD interrogation is complete. So there will always be a little bit of a delay.
Recognized, and I appreciate the comment, but again, going back to my comment is that where as soon as we are able to identify that, we can make response adjustments. I'm doing it until the
Absolutely,
time we arrive on scene, which is
Right.
what we're trying to do, be able to reprioritize and redirect, just like an ambulance
Right.
would be able to.
I understand.
So anyway, in the context of this discussion here, again, thank you, Mike, for, you know, your willingness to step up, and Leslie, we've been working on this. I'd like to keep working on it, obviously from a technical solution, but again, from the issue of the policy where it says that shall be provided, the determinant code shall be provided to the fire side of the house. It's a little light. And I would just like to see us maybe be a little more specific forward.
Is that something that, Steve, that we would put in a policy revision, or subcommittee would develop new policy as an off-cycle change?
That's possible. Unless listening to Chief here, and how it would get put into policy. It sounds like you're asking for more specifics in policy, because this is, I mean, as I read it, it's pretty clear. EMD is done as soon as determined it's available to the first responder. The details of how it's done is clearly not here. But that, you know, also, you know, as Leslie's saying, it involves multiple agencies that we have some responsibility to provide direction, and then some that are truly independent of us. So, you know, we're very clear that, you know, we can't provide policy direction to independent bodies that we have no, you know, statutory or regulatory authority to deal with. So I guess that goes back to the question, are you looking for us to provide more detail in process? I guess that's where I'm trying to meld everything, what to put into policy, because again, it can be a policy issue. What level are you looking to accomplish, I guess, is the question. What would be beneficial? How do we, you know, that's what I'm looking at, is what, you know, what we can put to make it work for what you're trying to
Maybe I could
accomplish.
suggest, on the back of what Mike suggested, maybe making an ad hoc, just a working group to just kind of talk through that a little bit.
Because
I'd like to make sure, I absolutely respect your comments about, you know, policy change, and we don't affect change for ECD policy or anything else, but I would very much, you know, they have to be at the table, and I'd like to come to some sort of understanding. But again, going through this process is what called my attention to the policy, and it just immediately says you'll provide it. But it doesn't really say how, so I think, and to answer your question, I'm looking for probably a little bit more detail on the how.
Okay, so here's, again, this, listening to all the discussion, something that, you know, again, policy to me reads fine for what we're trying to accomplish, immediate transfer of information. That's what it says. On the other hand, what I'm hearing are the technical issues are the barrier to this happening effectively. So perhaps that's the actual place to work, in which sounds like it's being discussed. Perhaps a more formal, you know, hey, let's get together with each of the agencies, fire, AMR, ECD, coming together to say, we want to work towards this common purpose. How do we make it happen? What are the, you know, issues that need to be overcome? And stating by being part of the group that they're willing to work on the issues and overcome it. Not a policy issue, it's coming together on a technical side of things, because again, I think the policy says we'll, you know, make it happen. So if that's the direction, again, it's a discussion item, so no recommendation from the group as an endorsement, but we can bring it back if you want to make it that, you know, level of endorsement to the groups. Hey, you know, we want you guys to get together, or you can just say, we're going to sit down and see if we can work something out, you know, without a vote from this body. Those are the two options that I see. Either, you know, unless someone sees something else.
Would having a vote in this body then ensure it was agendized next time so that we could follow up with chief and ensure that the creation of the group did occur? I'm sorry, how does that work?
And that's fine. Actually, good question. Again, because it's a discussion item, no recommendation, but at the next meeting, September, we can take a recommendation from this group to bring it back as an agendized item to have a formal vote move from this committee saying, we want these groups to get together and make this happen, and, you know, push it, you know, using the weight of the committee, you know, as the EMCC of Monterey County.
I think either way, AMR is definitely committed to that process. I mean, the data is there. I know that the flooding of data on the CADs is definitely an issue, but ensuring that it's streamlined. And I guess what we would like to avoid or impart on the process is the lack of individualization to departments, so that it's automated from our dispatch center.
I couldn't quite hear that well, but it seems to me there's two parts to this, as you alluded, Steve. There's the strengthening the policy or making the policy more detailed or articulating parts of it. Chief, I think that comes across loud and clear. And secondly, is the technical aspect of it. So maybe we should come back in September with a tentative course of action or recommended course of action on those 2 points. Does that solve your issue, Chief?
Yeah, I would say in the intervening time between our next meeting is that absolutely maybe get together with us, and I think.
Yeah, there needs to be a
Salinas
discussion
is happy
beforehand.
Salinas is happy since it's mainly our issue I'm bringing to the table, perhaps with AMR and with ECD, and we get to the table and just keep this as an agenda item for our next meeting with an update. Not necessarily an action, but if what comes out of that discussion is if there is a policy discussion that needs to continue, we can continue it, or if it's merely a technical thing that we can solve in our sandbox and not involve changing policies, then that's the way we go.
If I could make a recommendation based on what I'm hearing, is have the EMCC membership or a member, doesn't, you know, fine, request that be brought back as an action item. That gives you the opportunity as a group to take an action if you wish. But as far as policy goes, have that follow the technical work, because then the policy can say, this is what we're intending to do. Because right now, without knowing what actually can be done, and ensure everybody's on board, that.
Chief,
Yes.
If I may, I think Chief Clement was saying to bring it back in September for an update. I don't know what action, if any, could be taken because first meetings would have to take place. I think that from the agency perspective, we can commit to participating at these meetings in an effort to bring resolution. Changes to the policy, I don't think that we can offer changes to the policy until the meetings take place. We pinpoint what needs to be done and how that can be incorporated or how that affects the policy. But I don't believe that an action item is appropriate for the next meeting. As Chief Clements said, we can keep it on the agenda. We will bring an update to the committee. And in the meantime, offline, then we coordinate with Chief Clement, AMR, and County Communications to schedule the meetings and hold the meetings and have the discussions. I think that, I don't think that there's an action item that can be brought back in September. In the meantime, as the discussions happen, we, the EMS agency, can take a look and see, well, how is in any way the policy needs to change.
We'll bring
I'd
back
like EMS to
discussion.
be part of that
Sure,
discussion, so. Thank you, everybody.
we'll continue this item.
So in the new business item B, we go with that, all right? And announcements for the good of the order. Any member of the committee may make announcements or comments. The EMCC may not discuss or take action on any item raised during announcements except to decide whether.
I have one. In the past, I've brought up a request to look at other types of data, response data, and how it affects our system, in particular, how the prison is impacting EMS system at large, and honestly, South County, to know what is and what isn't. So I'd like to see that go on the agenda for next month or the next meeting. Appreciate that. Thank you.
I would second that too, because that is a growing factor.
Apologize for a process question here, because
Yes.
that does not get voted on or
No.
discussed. It is just on table.
It is, well, actually, it's a member requesting something on the agenda. So we'll work to include it into the agenda for the next meeting.
And then Will, I have one thing to just discuss under good of the order. And that's, so as most of you know, on March 3rd, 2024, there was a drive-by shooting down in King City. And the multiple departments and individuals responded to that, including dispatch, CalStar, King City Fire Department, AMR, and the incident was reviewed by the EMS agency from an MCI standpoint, and we looked at how we responded as a system, as well as how individual departments responded. We presented our review at Trauma QIC and CQI TAG, and I just wanted to note that our review of the process and the response to that MCI was extremely favorable. That we felt as an agency that really all the stakeholders who were involved in that process did an exceptional job in a very difficult situation. Unfortunately, there were multiple fatalities from this drive-by shooting that occurred at a private residence during a party. And the first arriving ambulances found also multiple critically ill patients that needed to be transported. It was further complicated by the fact that some patients left by private vehicle and went to Mee Memorial, the closest hospital, where they presented. And so we ended up with both a primary location and a secondary location for the MCI, which complicated factors. Of course, me not being a trauma center, did not have all the resources that they needed to manage critically ill trauma patients. And they had to stabilize patients, do a rapid re-triage, and arrange for expeditious transfer of those patients to Natividad. Natividad, for its part, also we felt exceptional in its ability to communicate its resources and to essentially accept every trauma patient from this incident who needed to go to a trauma center. So we were able to keep all these patients in county, which I think speaks to the depth of Natividad's ability to manage patients and to provide excellent care. So sort of from all standpoints, we felt that this was really an exemplary example of how an EMS system should work. Not just one outstanding department doing a great job, but kind of the whole thing coming together for the betterment of the patients who were part of this incident. And so the EMS agency wanted to put together a letter of commendation for all the agencies and individuals who were involved in this incident. We've done so. Of course, not knowing how EMCC was going to go this morning, we addressed it to Chief Langford. So we'll change that to Will and
John Anthony.
Oh, John Anthony, of course. Boy, see, everything's changing. So and then we'll reissue this letter to each of the agencies involved who will be CC'd on the letter, so that you have it to kind of memorialize and we just wanted to really express our gratitude for the work that went into this incident, how well people work together. Makes me proud to be medical director of a system that works so well. So
Thank you. I just wanted to update folks. We've had some retirements. So Division Chief of EMS, Shane Vanderveen, is stepping up as the interim deputy chief right now. And Captain Paramedic Stephen Christie is actually backfilling Shane's shoes as our EMS division chief, acting division chief of EMS. And also thank you, Chief Langford, for the chair of this committee.
So off the next meeting.
Almost. As a secretary to EMCC, I'd like to also thank Chief Langford for being very easy to work with as the chair of this committee. Made it a pleasure to serve this body and to support him as chair. And I want to say thank you for doing an excellent job for the past year and a half. I believe you were the chair. So thank you very much.
I'd just like to say, in naval terms, I'll hoist Bravo Zulu. Jim, well done.
Yes, thank you. Well done. And with that, on to the next meeting.
So next meeting, our next regularly scheduled EMCC meeting is for Wednesday, September 11th, 2024 at 10:30 a.m.
Good job. Thank you very much.